So in terms of conceptualizing sustainability, so sustainability has been defined a number of ways. So Marianne Shire and Jim Deering in 2011 defined it as the continued use of program components at sufficient intensity for the sustained achievement of desirable program goals and population outcomes. And in our annual review of public health paper, Shannon Wilsey-Sturman and Brittany Cooper and I identified what we saw as really three critical indicators or components of sustainability. And those are continuation of program components or the core components or elements of the evidence-based intervention, continued delivery of an impact on health outcomes or health behaviors, and continued presence of capacity building, whether that's resources that were in place or community level partnerships or coalitions. What's happened in the field is initially when people were thinking about sustainability, it was often conceptualized as being synonymous with institutionalization, which is really thinking about the routinization or organizational level practices that are routinized and made into policy or practice or institutionalized in budgets. I think the field over the last 5 to 10 years has really moved away from thinking about sustainability as including necessarily a focus on institutionalization because, again, there's been this recognition that sustainability takes place in dynamic contexts with dynamic changing evidence, dynamic changing populations and population needs and communities. And that really sustainability needs to be a dynamic concept and one that relates to concepts of reinvention or evolution of evidence-based intervention. So again, we've moved away from kind of a static conceptualization to a more dynamic. So again, there's been less focus and less measurement on institutionalization in particular. The definition of sustainability has also evolved over time. So Shannon Wilsey-Sturman in her article has a great definition of it focused on a little more specific, so if sustainability would be if after the initial startup implementation support has been withdrawn, the core components of the intervention were maintained. And again, sometimes that can be difficult to determine what those core elements are. But again, are they, do they remain recognizable? Are they delivered at sufficient intensity to yield desirable health outcomes? And does the organization or setting have the enough capacity for continuing these elements? Is that still in place? So I think that's a great definition. And most recently, Moore and colleagues have kind of made this even a little bit more specific in terms of their operationalization. And they define it, after a period of time, the program, clinical intervention, and or implementation strategies continue to be delivered and or individual behavior change, so clinician or patient is maintained, and the program and individual behavior change may evolve or adapt while continuing to produce benefits for individuals or systems. So this conceptualization starts to bring in that adaptation and that dynamic nature of sustainability, which hasn't been present in the past. So again, this definition, I think we're getting more comprehensive and more specific in terms of its operationalization. And as I mentioned, there's been a number of challenges and a number of reasons of why this field has been very underdeveloped. So again, like much of implementation science research, the fundamental nature and the fundamental challenges of the field relate to the fact that a lot of our evidence base is informed by systematic reviews, which have a focus on internal validity, not external validity. So again, we often don't know which interventions are going to fit in the context where we expect them to be sustained or under what conditions or populations. And again, a lot of our metrics of effectiveness in these systematic reviews has been on short-term types of health behaviors and health outcomes. So again, there has not been, the focus in our evidence base on sustainability. Much of the work in this area has been single site, often descriptive and exploratory, primarily qualitative. It's rarely been guided by conceptual framework, so often people focus on one aspect, maybe the organizational context, but rarely focus more comprehensively. People have used variable definitions of sustainability and often don't define sustainability at all. Typically, in many cases, sustainability has been measured dichotomously. So is the program still in place? Yes or no? Which, as we know, there's often multiple components, and there's whole issues around social desirability of self-report. There's been variable time periods for follow-up. In some cases, that relates to the health issue or health intervention being delivered and makes sense, but typically the periods are variable and often short-term, so maybe a year out, but typically not much more than that. They're rarely prospective, so they're often either cross-sectional or retrospective, which also has a whole host of issues. And again, adaptations, the extent to which the intervention is delivered as intended, or adaptations that are made to capture changing and dynamic contexts or settings or needs, or to integrate and better fit with the context. Those are rarely captured. So again, just to give you a snapshot, there's been a lot of challenges and a lot of limitations of the existing research.